What is the usual process that happens from going from discovering a lump to a full-on diagnosis?
Okay, so you would go to your doctor or to the primary healthcare facility, a clinic, because a lot of us do access clinics as well. You'll complain. So what the doctor or the nurse would do, they would take a history, find out when you noticed this lump and all the symptoms that I've just experienced. And remember, you don't sometimes need to have any symptoms. An important question as well is finding out about your family history. Are there any women or even men who've had breast cancer in your family? Because that increases your risk of breast cancer. Another important what we find out in women as well is what we call your gynecological history, when your period started, if you are in menopause or you're still having your regular periods, pregnancy. Okay, because pregnancy is actually protective, you know, in breast cancer. And also we ask about contraceptive history. That's very, very important, because remember, there are different types of contraceptives as well. But if you're using hormonal contraceptives, those also may put you at a little bit of risk. So they will take a history and then they would examine you.
Yes.
As well, lifestyle is very important as well. Smoking is a risk factor for any cancer.
Yes, yes.
And alcohol as well. Asking you how often do you drink, all those are risk factors. And then we also, when they examine you, weight is very important. You know, I ask about height. Yes, your BMI as well. The bigger you are, you are at risk of certain cancers as well. You also ask about your functional status as well, because you know what, I've seen the women who are active, who exercise regularly, even that's in men as well, they do so much better as well, because their body is used to working and it's used to fighting, and your body is at a much healthier status as well. After that, the examination, they would send you off for imaging. So imaging would be capturing a picture. So you would go to a radiology department where they need to take pictures. So they would take a picture of your breast. The doctor there as well would examine. They would take a picture of a breast, which would be either a mammogram, ultrasound as well, to look into your breast tissue, to see if there's any lumps or any abnormalities inside the lump. And then they would biopsy. So this would be putting a needle in and actually taking a piece of tissue out, which would then be sent to a lab to see if this is breast cancer or not.
Do you do that awake or asleep?
They do that awake, but they give you anesthetic, so they numb the area.
And the reason I ask this, I want to make sure that none of you don't go to the doctor out of fear of the pain of everything that's being explained.